we will have Latasha Terry, and following that will be Dr. Ramkumar Jayagpolan. Latasha Terry? Okay. All right. Is Dr. Ramkumar Jayagpolan in attendance? Okay. Welcome. Glad to have you here this evening.
Thank you. I want to thank the committee for giving me the opportunity to testify today. I'm Dr. Ramkumar Jayagpolan. I'm a pediatrician here in Columbia, South Carolina. I'm also the Treasurer Secretary for the South Carolina chapter of the AAP, and I also serve on the board for the Children's Trust of South Carolina, which is an organization focused on preventing child abuse and neglect in South Carolina. Today I'm here to talk about the need for our state to expand the home visiting programs in our state. Home visiting services are programs. These are voluntary programs which matches participating parents, especially those of young infants and children, with a trained professional who then coaches them and mentors them in helping them raise children who are healthy and successful, and they get a good, strong start in their life. South Carolina has been going in the wrong directions when it comes to infant and maternal mortality rates. Our rate of infant mortality is currently at the highest since it's ever been since 2012. And I think the rate has risen about 40% since 2017, and we are like fourth highest in the country. We know that the home visiting programs have shown the families who participate in these programs have lower infant and maternal mortality rates. Their children have better health outcomes. They do better in the school, and there is decreased rates of child abuse and neglect in those families. And especially the home visiting programs helps those families who live in the rural areas. As we know, the access to healthcare in the rural areas are like a big issue for our state. Beginning in 2024, South Carolina has a great opportunity to expand home visiting programs through a federal matching grant through the Children's Trust of South Carolina. If we invest $250,000 through Children's Trust of South Carolina, we would get 3 times that matching grant to expand home visiting services. That means more families would benefit from home visiting services, and more children and infants would get a stronger start to their life. As a pediatrician, I've seen firsthand in several practices that I've visited how the home visiting programs impact the families that we serve. It makes a big difference. So I urge the committee to look into investing in this matching program in 2024 so that we could expand the home visiting programs to meet the needs of more families. That's all I have, and I'll take any questions.
Thank you so much. Do we have any questions from the committee? Yes. It's fine.
Very, very brief question. How does a family who would be a potential good choice to be in this home visit program, how are they identified?
So we look for like families that are high risk, those who have more social needs or complex medical needs, and those families are then matched with the appropriate evidence-based program that we serve.
And if they choose not to be matched, is it something
yes.
that's thrust upon them, or is
No.
DSS involved or anything? Okay.
No, these are completely voluntary programs.
Okay.
So the families choose not to, then they're not forced.
And do you find that most families welcome?
They welcome them with both hands. Yeah, it helps them. Not only helps them give more information, teaching, but also helps them link with like community resources. So they love it.
Okay. And final question: if you were to receive that matching grant, the 3x1 matching grant, how many more families could you involve? You think?
About 800 more families in the next year.
Okay. Thank you.